you, Dr. Burgess. I appreciate it. And I appreciate your interest in all of this. How about if I walk you through the bill, where we are in the debate, and then I'd be happy to answer your questions. There are a few things that are being said today by the President in particular on what ought to happen in healthcare reform. If you like what you have, you ought to be able to keep it. We ought to have deficit-neutral healthcare reform. Healthcare reform should bend that cost curve, and if it does, healthcare reform is entitlement reform. I agree with all of that. Unfortunately, the bill that's moving through the House, the bill the President's backing, doesn't do those things. It actually makes those goals harder to achieve. We think this bill and this approach makes those goals achievable and actually achieves those goals. I think it goes without saying, but nevertheless it ought to be said that we need to embrace preventative medicine. We need to embrace disease management. 5 chronic diseases, heart disease, cancer, stroke, pulmonary disease, and diabetes cause 2/3 of American deaths. A lot of this is preventable. Second, insurance. This is a really big part of this debate that has been very much overlooked. And the current status quo, I would argue, is unsustainable, and I think everybody argues it's unsustainable. What you have here is a choice that's being given to the American people rhetorically that is a false choice. The choice being given to the American people right now is either accept the status quo or take this plan moving through Congress, which creates the public plan option. It's one or the other, and that's just not the case. There are other ways to fix this problem, and I would argue there are better ways to fix this problem that do not involve the government displacing the private sector, the government taking over this 17% of our economy, and that do not take away customers. The key goal that is accomplished with this kind of approach is, number one, we want to make sure that everybody who does not have health insurance today can get health insurance. Number two, we want to make sure that everybody who does not have health insurance because of a pre-existing condition also can get health insurance. You have to have an answer for that person who has a history of, say, cancer or diabetes or something like that to be able to get health insurance. And the way the majority is taking this approach is through mandates and costly regulatory mandates like community rating and guaranteed issue across the board, which we believe will needlessly raise the prices on everybody when we should be focusing our support and our aid on those who cannot get health insurance. How do we deal with the cost issue? How do we deal with making sure the uninsured get insurance? A few things. Number one, we believe we should equalize the tax treatment in healthcare. We believe that one of the great sources of health inflation is the structure of the tax code itself right now. In World War II, this was an unforeseen, unintended consequence of the wage and price controls that occurred at that time. And the IRS gave a ruling which simply said that we will not tax health insurance benefits. It was a way for business to attract labor outside of the fact that they had these wage controls. And what evolved out of that was this third-party payment system that we have today. It was a payment system where the tax benefit is attached to the job and not attached to the worker. And that kind of a payment system worked fine in the last century because, you know what, people usually had the same job for their entire career. People usually had the same job for 40 years for their entire lives. And so long as that was the case, that worked okay. That is not the society we live in today. That is not the dynamic and the way of the labor market in the 21st century. And so what we say is, number one, let's end the discrimination against people who do not get health insurance from their jobs. And that's more and more people these days. More and more employers are dropping offering health insurance to their people. And so if you're self-employed, if you're running an internet business out of your home, if you work for a company that doesn't offer you health insurance, you get nothing, not a zip. No tax preference whatsoever. So what we're suggesting is take that tax exclusion, take that tax preference, which arguably is one of the greatest sources of health inflation, and delink it from the employer and reattach it to the employee. Big difference in discussion between how we treat the tax exclusion and how, say, Senate Democrats are talking about it. No Democrats here in the House are talking about dealing with the tax exclusion. But the idea that you have sort of floating around in the Senate with respect to the tax exclusion is to take the tax exclusion, take that money, and give it to the government. Take it away from the taxpayer, where it is attached right now, and give it to the government to create a new spending program, to create a new government plan. That is not what we are proposing, and that is a net tax increase. We are saying take that tax exclusion and give it right back to the taxpayer from which it came. And the way you can do that then is to equalize the tax treatment. So that if you work at a job and the employer does offer you health insurance, that tax benefit is yours, not your employer's. You can use it to keep what you've got, or if you change jobs, lose jobs, go work for yourself, that tax benefit goes with you. It's portable. Here's making those ultimate decisions. See, the problem with that decision is it denies the ability to customize care and treatment. Each patient has a unique and different problem. Physicians are smart people. Physicians ought to be able to have the incentive, ought to be able to have the discretion and the ability to customize the care to each patient's needs. Just a critical component to this, and this should not be controversial, is to have standard metrics on price, quality, obviously digitize these records so that that flows more freely, so that the patient and the consumer can truly shop for better value, and you do reward excellence. This model is a model that encourages innovation and excellence in healthcare. It's a bill that is revenue neutral. It is a bill that is deficit neutral. It is a bill that actually lowers the cost curve in the out years to help us solve the entitlement reform problem. But it's also a bill that gives every person in America universal access to affordable health insurance, regardless of pre-existing condition. So it solves those problems, and it truly does give people the ability to keep what they like, what they have, if they like it. This is the alternative approach we are proposing to the government-run, government-centric approach. And we think this battle of ideas, this competition for how to fix this, ought to be done thoroughly, ought to be done exhaustively, ought to be done right, and not rushed to the floor as we are being told still is going to occur next week. We voted on this bill last Friday at 2 in the morning in Ways and Means. We got the bill at 11:57 p.m. the night before. Nobody read it. Nobody understands all the tax problems. We've read it since then, and the point is the American people are being shafted. They're being denied the kind of debate that we ought to have for legislation that will take over 17% of our economy, that will affect something as intimate and personal to them as their health care. Let's do it right, and I'm saying we are not the party of no, we're the party of saying let's do this thing right, and we believe we have good ideas to offer. Unfortunately, our colleagues in the majority have directly told us they're not interested in our ideas. They don't need our support. They don't need our involvement, our collaboration, so they're not asking for it. And with that, I'd be happy to answer your questions. Thanks.